Monash Sustainable Development Institute Research Seminar for the year. These seminars aim to spark interdisciplinary conversations on the grand sustainable development challenges of our time. My name is Becky Battergall. I'm Associate Professor, the Faculty of Law and Associate at Monash Sustainable Development Institute. I want to start by acknowledging the people of the Kulin Nations, on whose land Monash Sustainable Development Institute is situated, and where many of us are gathered today or sitting at different places. I pay my respects to Kulin elders, past and present. I think today's seminar has relevance in the colonial and post-colonial context. We're focusing on contexts in Indonesia and Fiji, which have long been colonised, and there are lots of connections we can make between the gender and socially inclusive work being done by researchers Naomi and Allison, and the work that we're doing at MSDI and at Monash and beyond with our own Indigenous peoples. So it's really fantastic to have you here today. We are welcoming, and I've just lost my page, Dr. Naomi Francis and Dr. Allison Salinger to talk about a project that's very close to my heart, funded by the Australian Government's Water for Women Fund through the Department of Foreign Affairs and Trade. We're looking today at gender, community engagement and social capital around water-sensitive infrastructure in urban informal settlements. Today, Allison and Naomi are focusing on participatory design and how we can better design water infrastructure in urban informal settlements, slums, to include everybody across those communities in the design of that infrastructure. Traditionally, the way the infrastructure is designed is it excludes the communities and at least only includes those who are identified as leaders. The work that Allison and Naomi are presenting today builds on the work that Monash, Emory and other universities are doing through the RISE project. So today, I want to introduce the speakers. So Allison Salinger is a research associate at the Rollins School of Public Health at Emory University. Allison holds a Master of Public Health in Global Health from Emory University with a specialisation in WASH, that's water, sanitation and hygiene. She's worked within NGOs and academic institutions to conduct research and evaluations of community-based WASH initiatives, and with a particular focus on gender and social constructs to facilitate collective action in water and sanitation. Dr. Naomi Francis is a research fellow at Monash Sustainable Development Institute. She has 10 years experience working as a researcher, engineer and educator in international water, sanitation and hygiene projects. And she has a lot of her work is focused on gender and development. Naomi, we're very lucky at MSDI to currently have Naomi as a research fellow with us as part of the RISE program. Naomi and Allison are going to speak for about half an hour to 40 minutes, and there'll be plenty of time for questions. If you'd like to ask a question, you can put that in the chat as they're going, or you can save up and ask later, either in chat or in person. Please join with me in welcoming Allison and Naomi.
Hi, everybody. I'm going to share my screen. Oh, wait. Can't do that in that order. Can everyone see now? Yep, I'm getting thumbs up. Fantastic. Thank you, Becky, for that introduction. And thank you, everyone, for joining us. I just saw a bunch of familiar and some non-familiar faces and some people we haven't seen for a while popping up on the screen. So that's really nice to have you all with us today. So we'll get stuck straight in. Allison and I wanted to acknowledge that we're representing a broader team. We're from 4 main universities, Emory University and Monash, as Becky mentioned, but also the University of the South Pacific in Fiji and Hasanuddin University in Indonesia. So a lot of you are already familiar with RISE, but we're going to quickly summarize it for those who aren't. RISE is the Revitalising Informal Settlements and Their Environments program. It's an action research program working at the intersection of health, environment, water and sanitation in urban informal settlements. The vision really is to improve health across 3 different realms, so human, environmental and ecological health, as I said, in informal settlements. and it's using a novel approach to water management. So sometimes we call this nature-based solutions or water-sensitive urban design. It started in 2017. As I said, it's action research. So there's an intervention component and a research component, and it's set up as a randomized controlled trial. So we have 24 settlements. They're split across Suva, Fiji, and Makassar, Indonesia. There's 12 control and 12 intervention sites, and an additional demonstration site in each location. So there's about 7,000 people involved altogether. So what is RISE? As Becky mentioned, there's a co-design and participatory design aspect to RISE. So there is technology that's externally designed, but with RISE, that technology isn't just planted into context. There's a component where aspects of the design are negotiated and discussed and co-designed with residents or participants in the program. In terms of the technology itself, for some households who don't already have toilets and showers, they're being provided with a wet pod. So that's just a toilet and a shower and a sink combination. But the real focus of the technology side is around the capture and treatment of black and grey water. So for the black water, that's a pressure tank that's shared by about 4 or 5 households to capture water from toilets. That then goes into a septic tank, a subsurface and a surface wetland and out into the environment. And for the grey water, which is water from the showers and the sinks, there's a biofilter, and then that goes out into the environment as well. So that's the technology side of it. And as I said before, the program is really focused on 3 aspects. So not just the physical environment or just human health, but really a combination of physical, ecological, and human health. And for this reason, it really is a planetary health project. The success of RISE is going to be measured by health and well-being in those 3 categories. So for human health and well-being, that's particularly for children under 5, as well as the ecological diversity and some of the physical environment aspects as well. So where does our project come in? We started a couple of years after the inception of RISE, and we're funded, as Becky said, by the Australian Department of Foreign Affairs and Trade through a fund called the Water for Women Fund. It's a multi-university collaboration, it's multidisciplinary, and it's multi-country. So it's a very diverse add-on project in itself. So some of you, and I suspect given the audience, most of you won't be, but some might be asking, why would we be thinking about gender and social inclusion for a water project? And there's a tendency, I guess, to focus, and this is, my background is in water engineering, so this is where I'm coming from with this statement, but like, there's a tendency to focus our technological or technical aspects of our work and design these outside of context and then plant them in context, and problems emerge when we don't take the context or the social realm sufficiently into account. And as I said, I don't think that's big news to most of us, but for those of us who it is familiar, the application or the practice of that is really tricky and messy. And so when we do introduce our technical designs into the social realm, we face problems. And the 2 main categories of problems, I think, are that, first of all, we don't always meet our objectives. So this photo here is of a WaterAid provided toilet somewhere in Timor-Leste. The man whose house this is was really happy with his new kitchen, but he was still open defecating. So WaterAid's objective of improving sanitation wasn't met. So that's one problem. The other problem is that we leave people behind. And so even though we think and we aim for our technology to be accessible by everybody, it doesn't always do this. And this is an example from Australia. In some work sites, there's toilets for everybody, but you can't change a tampon in them. So people who menstruate are having to drive 15 minutes each way to the local petrol station. And that's bad for everybody, bad for productivity and bad for people who need to change the tampons. So we're not meeting our objectives and we're leaving people behind. So this is what really drives funds like the Water for Women Fund and what really motivated the add-on Water for Women project. So our team has 2 main objectives. The first one is that we're trying to generate evidence on the gender and socially inclusive co-design approach to WASH being demonstrated in the RISE intervention. The other objective is that this evidence will inform a toolkit that we're designing for this kind of work in urban informal settlements around the world. So those are our main objectives. We've also got a few research questions. Overall, I'm just going to read this out because it's quite wordy. Our overall question is, to what extent is an intersectional gender and socially inclusive community engagement and co-design approach to WASH in the RISE program effective in providing diverse men and women with resources to respond to shocks and crises, including COVID-19? So to split those into two sections, the first research question or sub-research question really looks at what are the key elements of the RISE program and how is it an intersectional gender and socially inclusive program? And the second question is around what is the impact of that program on diverse men and women's resources to respond to shocks and crises as measured through their social capital. So Allison's going to talk soon about the second research question, but I'm going to go quickly over our methods and initial findings for research question 1. So just to recap, this was around what are the key elements of the gender and socially inclusive aspects of RISE. And we've got 4 sub-questions. So the first one is around why is community engagement important? And we felt that this question helps us to understand the other 3 questions, I guess, to see where the participants were coming from in their understanding of community engagement and inclusion. The second question was around what strategies were being used in RISE to include diverse residents, what was observed about their participation, and finally, a question that looks internally at the RISE team. So it's asking in what ways is the RISE team diverse and inclusive itself? And that was really about us walking the talk. If you're wanting to do gender equality and inclusive practice with your program participants, then you need to look at your team as well. So our method changed a lot. The travel ban of March 2020 timed perfectly with us leaving to Indonesia to start our data collection, so we've had to adapt along the way. And in some ways it hasn't been ideal because we haven't collected as much data directly with residents as we've wanted to, but I think we've adapted quite well, and we collected a lot of data remotely, and we leaned heavily on our teams in Suva and Indonesia. So we were really lucky in that sense. So overall, we managed to get semi-structured interviews with diverse residents in both Suva and Indonesia, and we tried to target or tried to sample for a diverse group of residents. So people of different genders, people of different functionality as measured by the Washington group questions, which are a proxy for disability, as well as the level of their participation in RISE activities. And these were all self-identified traits. We interviewed the Makassar and Fiji-based staff, and we've also interviewed representatives of the Leadership Project and PhD students cohort from RISE who are based in the USA and Australia mostly. We coded the transcripts, and we're currently analysing those coded segments. Underpinning all of this, or for research question 1, is a conceptual framework that comes from implementation research called the Consolidated Framework for Implementation Research, or a CIFR. It's a way of describing an intervention. And so there are 5 main domains: the intervention characteristics, the outer setting, the inner setting, the individuals, and the process. And CIFR is traditionally used for healthcare settings, so interventions in a healthcare setting. So it might be like a new hand washing program in a hospital, for example. So it's not perfectly suited for the setting of RISE, but we have adapted the CIFR framework for this project. I don't have time to go into what all the domains exactly are, but broadly it divides the intervention into aspects of the intervention itself. So like your design principles, the complexity of it, whether you've tried it or not, whether it's a pilot or not, whether you can adapt it or not. And then there are some contextual features, so things like what the residents want, how well the existing sort of political framework, the existing policies and incentives that exist, characteristics of the individuals involved. So this might be your project staff, their expertise and competence, or their values and motivations. And then you'd have the culture of an organization, the structural characteristics of that organization. And then the process includes things like whether things went to plan or not, what the execution of the intervention looked like in the end. So this is a very quick walk through our conceptual framework. I can answer more questions about that later if people are interested. So briefly, I'm going to qualify I'm going to present some findings under each of our 4 sub-questions really quickly. Just to qualify though, these are based on a very brief analysis of our interviews with staff in Fiji and Suva only. So there's no resident data in here, and there's no data from leadership or project staff based outside of Fiji or Indonesia. So why is community engagement important according to staff? It wasn't surprising that there was a very diverse mix of responses. Overall, people were like, to make sure the project works, which is not a detailed response, but it indicates how important the staff overall felt that community engagement was. So more specifically, some staff felt that it was important to make sure that the community understood why they were getting sick, because this is the main outcome of the RISE program. Other people felt that community engagement was more important in the sense of getting consent or permission or buy-in and trust, making sure that the community understood what was happening to them in their community. Yet others felt that it was more of there was more of a moral imperative, so that to adhere to human rights, that you shouldn't do things with or to people without them. Others felt that it was important to understand resident needs and priorities in terms of their access to wash. And yet another group felt that it was very important to do this engagement from a very practical perspective. So we needed contextual information about physical space and social rules to make sure that the technology worked. And you can't do that without community engagement. And also to ensure the sustainability of the technology and the maintenance. You need to bring people along, show them how it works, involve them in the construction so that when things break later on, they can maintain it. So these were some of the motivations for community engagement. In terms of what strategies were used to include different people in the RISE intervention, and I should qualify this by saying these were not just strategies that were used to include everyone as a group, they were strategies that were used to include specific groups. So that might be women, or it might be people who spoke Hindi, or it might be people who spoke, who were younger, for example. So a formal mechanism that was used, or a formal strategy, was that in the setting up of community engagement members in each community, there was some criteria for selection, and these were there was quite specific. So it included people who were interested, for starters, but also women and young people. So that was a very formal, direct way of making sure that women and young people are included. Less formal strategies included individual contact with households. So a lot of the RISE engagement strategies consisted of big group meetings or community meetings or workshops, but these were always followed up or preceded by individual household visits to make sure that people had received invitations, had understood the content, to go through a consent process with them, and also to go through design aspects with the household. So of course, this doesn't go into intra-household dynamics, but it does mean that that level of granularity was addressed through the engagement mechanisms. And that meant that people who wouldn't necessarily participate in a community meeting could still be involved at the household level. And staff felt like these household visits were a good way to check on the specific needs of diverse people. Another strategy that was used was to disperse the RISE team throughout the co-design workshop. So when there was a big group activity, to make sure that people who are a bit quieter or shy or having trouble understanding had a RISE staff member near them to help them individually with them, and make sure that their views were being recorded somehow. So even if they weren't speaking up in the workshops, their perspectives were being captured. In some places, having a separate men's and women's focus group for those workshops was a way of making sure that different people's views were captured, or different groups for different languages spoken. And finally, this is just one example, but adaptation to the context was key. And so the project teams in both countries would adapt to the context of the different settlements to make sure everyone was included. So one place in Fiji that the team went to was consisted of 5 very distinct clans, and it didn't make sense to have one big meeting for all of them. So they did 5 separate design workshops with the clans. So more work for the team, but it's a really good example of how they adapted to context to make sure that different people are included. What they observed about participation, again, I'm going to qualify this is just coming from the staff. It's obviously not a perfect way to capture observation of participation, but it's what we had. So brief observations so far have been that, unsurprisingly, participation of diverse groups in co-design workshops was different in each settlement. Sometimes more women were involved, other times more men were involved, and it depended on the activity. Men and women were engaged in RISE for different reasons. RISE was often seen as a women's project, and we think that that's possibly because women are the primary caregivers of children, and RISE is all about the health of children under 5. So women tended to be more engaged in the beginning in some settlements, and then the men would become more engaged as the intervention shifted into the construction tasks. The staff reflected that it was easier to engage with different genders for different tasks. So trying to organize a community meeting was often easier to do through the women in some places. And for different types of tasks, different groups were easier to engage. They also observed that decisions were made by particular people in different contexts. So it wasn't always formal leaders who made decisions. Sometimes it was those with high education or high income, people who knew the most or were perceived to know the most about a wash intervention, for example. And at the household level, sometimes it was men who made decisions, and sometimes it was women, sometimes together. And finally, the last sub-question, which was really a reflective one, was around the diversity and inclusion within the RISE teams. A lot of the staff reflected that having a representative team was important for 2 reasons, both for the program participants, the residents, to feel comfortable. For example, if someone was going to a house to talk about the consent process or to do a survey, much more approachable if there was someone of each gender or someone of the same gender as the person who was home. But it was also for the safety of the RISE team members, to have both men and women in the team working together. A lot of staff reflected that they felt that there is gender balance within the RISE program team at different levels. And then there are other areas of diversity within the team that are now more of a focus. So in some teams, trying to get more of a balance of different ethnic and language groups within our teams. Another major reflection from both the Indonesian and Fijian teams was that, and I think this is particularly with the onset of the pandemic and travel restrictions, was that decisions, more decisions and bigger decisions were locally led and channeled through the local leadership teams. And they felt like they were being more considered and more acknowledged by the Australian USA parts of the RISE program, which they felt was a good thing. So key lessons learned so far. Obviously, we've still got a lot of analysis still to do, but what we've reflected so far was, especially on that last point, that having teams that are based in the countries of the project sites with local staff has challenged some of the hierarchy and power imbalances typically found in projects that are funded by global donors based in high resource settings. That the diversity within the project teams, regardless of where they're based, has been important for engaging diverse residents. And this has been done particularly well in terms of gender within RISE. But there are other areas for more work, and staff feel that resourcing, capacity development and support for staff is needed to continue to do inclusive work, particularly in the realm of including people with disabilities. And as I said before, adaptability is key. The flexibility and the reflexivity of the staff and their response to context has been really key to making sure that RISE is inclusive of diverse people. I'm going to hand over to Allison to talk about our second research question, and we'll take questions about both questions afterwards.
Thank you, Naomi. So just as a reminder, so this is the same research question verbatim that Naomi had presented for our Q2 above, but just as a reminder, this research question was really about the relationship between that gender and socially inclusive community engagement and co-design approach that Naomi just described, and its effect on men and women's social capital in the settlements, the RISE settlements in Fiji and Indonesia. So there's a lot of existing evidence that's referenced here under the hypothesis section that suggests that sort of baseline or existing social capital can be predictive of both participation in and outcomes of community-based WASH interventions. There is less evidence out there, and the minimal evidence that exists is pretty mixed around the relationship between intervention activities and social capital in communities. So ideally, we would have that whole pathway, right? That intervention, sort of pre-intervention activities, these community engagement and co-design activities can create social capital, which then sets communities up for success to be able to work together towards that WASH program outcome, or to maintain and operate infrastructure once it's installed. So within the Water for Women timeline, we're looking at that first step in that pathway from intervention to social capital. And our hypothesis is that exposure to the RISE intervention, these engagement activities and co-design would have a positive effect on social capital in the intervention settlements. Thanks. So when we talk about social capital, what we're really talking about is sort of the features of social structures, or the features of the community, things like trust, tendency for reciprocity, for social support within that community, that can act as resources for the individual, but can also facilitate individuals coming together and engaging in collective action towards some group benefit. We can further break down social capital into structural social capital and cognitive social capital. And I'll get more into exactly how we measured those. But for now, structural social capital essentially is sort of the shape and function of social networks in the community. And cognitive social capital is all about perceptions. So it's people's appraisals of the social capital in their community. So these values, beliefs, and attitudes that are shared amongst members of the network, in this case, of the settlement. So all of the data that I'll present today comes from a household survey in which we targeted 2 adult respondents. So we tried to get 1 man and 1 woman to answer our questions from every RISE household. And we measured social capital using the Short Adapted Social Capital Assessment Tool, or the SASCAT, which is designed to measure both structural and cognitive social capital, and which we did a lot of work to adapt to and contextualize to the urban informal settlement, Fijian and Indonesian contexts respectively with our local field teams. So I won't get too much into that today, but we do have some hidden slides that if people have questions about what that process was like, I'd be happy to go into that in the Q&A. So this is the original SASCAT tool from De Silva, sort of before any of our adaptations. But the sort of idea is the same, and I'll run through the items one by one just so that we know what we're talking about and we're on the same page about what we mean when we say structural social capital. So these first 5 items are meant to measure structural social capital. This first item is about group membership. So essentially, out of these 8 different types of groups, which or how many really were you an active member in? Then out of those groups that you just told me you were an active member in, which ones did you receive emotional, economic, or instrumental support from in the last 12 months? And then similarly, looking at individuals and institutions, so folks like family and neighbors, but also government officials and NGOs, how many did you receive economic, emotional, and instrumental support from in the last 12 months? And then these last 2 items at the bottom are what De Silva calls citizenship activities. So the first is, in the last 12 months, essentially, have you engaged in collective action in your community? And then in the last 12 months, have you talked with a local authority or governmental organization about problems in your community? Then the last 4 questions on the tool are about cognitive social capital. Each of these items is meant to tap to sort of a sub-construct of cognitive social capital. So the first, of course, is about trust. In general, can the majority of people in your community be trusted? Per De Silva's recommendation after validation of this tool, we subdivided that into 3 questions that ask separately about whether your neighbors can be trusted, people you don't know well in your settlement can be trusted, and local leaders in your settlement can be trusted. Then the second question is to do with social harmony. So do the majority of people in this community generally get along with each other? The third question is about sense of belonging. So do you feel like you're really a part of this community? And then that last question is about sense of fairness. Do you feel like people in this community would try to take advantage of you if they got the chance? We can skip the next few. These are those slides about how we contextualized this tool. Happy to go into this later. Yeah, perfect, thanks. Perfect. So just something to mention about the methods, the timeline for the data collection of the survey. We modified all of those SASCAT items to refer to the time period, quote, 6 months before the pandemic or before Corona, depending on how our local field teams told us we should refer to it in the survey. In Fiji, unfortunately, that captures the time frame after the initial community engagement activities, but before that sort of September 2020 timeframe when those more intensive participatory co-design workshops were happening. In terms of our data analysis, we conducted a confirmatory factor analysis to confirm that 2-factor structure identified by the SASCAT, that the items that were supposed to measure structural social capital all sort of were related to each other, and the items that were supposed to measure cognitive social capital were all related to each other. And then once we confirmed that factor structure, conducted a structural equation modeling technique to determine the effect of exposure to the intervention on social capital using the CFA informed social capital subscale scores, which is a mouthful, but I will show it to you in a nice pretty picture and answer any questions at the end. Thanks, Naomi. So the visualization of our CFA results shows that two-factor structure that I was talking about, whereby structural social capital is made up of those top 5 items, and cognitive social capital is made up of those bottom 6. The grayed out boxes represent items that were not sufficiently related to the assigned factor. So for example, sense of fairness wasn't sufficiently related to, and so we can interpret that to mean wasn't sort of important for cognitive social capital in the context of Fiji or Indonesia. Whereas trust in strangers or people you don't know well was also not related to cognitive social capital, but only in Fiji. Within each country, the factor structure for men and women was the same. So we can interpret that to mean that social capital doesn't function very differently for men and women within Indonesia or for men and women within Fiji, even though it does function pretty differently for folks in Indonesia altogether versus folks in Fiji altogether. We then created those CFA informed subscale scores, so country specific subscale scores. So for example, the structural social capital score for Indonesia is the sum of group membership, social support from groups, and social support from individuals, but it doesn't include collective action or talked to leader, whereas the structural social capital score for Fiji is the sum of all of those 5 items. So we're talking about something slightly different when we talk about structural social capital in Fiji and versus Indonesia, but we're talking about what is most meaningful for structural social capital in those contexts specifically. And flip to the next slide, thanks. So then we performed that structural equation modeling that I talked about. All of the models are adjusted for clustering at the settlement level, as well as for average settlement wealth index. So in Indonesia, we can see that the intervention did in fact have a positive effect on cognitive social capital for both men and women, as well as a positive effect on structural social capital for men. You can go to the next slide. In Fiji, the intervention had a negative effect on both types of social capital for both men and women. Next slide. So what does that all mean? Essentially, the results from Indonesia suggest that yes, in fact, these early intervention activities can sort of manufacture or bolster social capital in communities, which is really exciting because we hope that that means that in the future, these communities, again, would be set up for success to better come together around the infrastructure that RISE is planning to install. In Fiji, the results are a little bit difficult to interpret at the moment because of that reference time frame for the SASCAT items. So we're pretty confident that one of 2 things is happening here. Either those early intervention activities created some tensions in the communities that truly decreased social capital at that time period. Maybe they were resolved later in those more intensive co-design workshops. Or alternatively, it's possible that the control communities just had higher existing levels of social capital from the beginning. We have collected qualitative data from residents in both countries, including questions that Naomi talked about that would help per research question, but also that would help us contextualize the effect of the intervention on social capital. And so we are working on analyzing those interviews, and hopefully that will help us understand what exactly is happening in Fiji, and also help us validate that positive relationship in Indonesia. Last slide, please. Finally, social capital did function pretty differently in Fiji than it did in Indonesia, and was impacted differently among men versus women in Indonesia. So this just methodologically emphasizes the importance of adapting tools to country context and confirming factor structure when we're talking about these more abstract social constructs that might look different in different contexts. And emphasizes the importance of collecting gender disaggregated data, right? We didn't know if it would be possible, how great of a response rate we would get, but everyone gave us, you know, a lot of their time, the field team and the household. So we're really grateful for our field team's time and our participants' time to enable these amazing gender comparisons. And then finally, these are the outputs from Naomi and myself and the rest of the Water for Women team that folks should keep an eye out for in the next year or so. So yeah, happy to answer any questions about these or about anything at this point that we've presented today. Thanks so much for your time.
Thank you, Allison and Naomi. Really fantastic to see those results coming out, those first results. And as Allison said, we're in the process of starting to analyse the quality of research. The quality of research only finished this week in Suva, and we hopefully have more answers. But also the other thing that really struck me as Allison and Naomi were talking was how it's amazing that you can present these findings in half an hour or so, but it's taken a good 2 years of really hard schlepping around the pandemic, not actually able to travel, huge number of hours on Zoom to achieve that. So congratulations to you both. So I just want to start with a question for you, Naomi, posed by Rob. And yeah, Jane, I acknowledge your response there. It has been hard work. It's about the CIFA framework, so the implementation science framework, which has traditionally been used in a health setting. We're using it in a new setting. So Rob asked a question, Sheila, who is the co-leader of our project from Emory University, responded around whether or not it informed the research questions, the data collection and analysis, which Sheila has confirmed it has, and whether or not, Naomi, could you suggest any adaptations or lessons from your data analysis so far of using CIFA in a new context?
Sure, and sorry, I should have said at the start, I was trying to keep to time, but yeah, it did inform the question guides and is informing the analysis as well. I'm looking over at my cheat sheet of the CIFA framework now. I've got to acknowledge Audra and Isabel from the Emory team who have done a lot of work on this with me. And we've discussed a lot about how we would adapt it for this context. And I think the main adaptation is that when it's used in a hospital setting, some of the key constructs in the framework, like the culture of the organization. In a hospital setting, that makes sense because you're talking about the culture of the hospital. Say you're trying to get staff to wash their hands more frequently, for example. One of the components that will impact how that intervention plays out is the existing culture of the organization, and in the traditional use of the CIFA framework, that would be the culture of the hospital. In the context of RISE, you can talk about the culture of the RISE program. So the way that RISE is set up as an organism, because there are multiple partners in RISE, and there's funders, and it changes over time. So you've got the RISE intervention culture itself, and then you've got the local culture of the community or the resident group that you're putting this intervention into or on as well. And so we divided that particular construct into two sections. There was the culture of the local community and the culture of the RISE organization itself. So that's one adaptation that we would use for this context. Another construct is around self-efficacy. So when you're trying to get people in a hospital setting to wash I'll go back to that example, to wash their hands, one of the things that impacts that is whether people believe that they can wash their hands effectively. You know, you need to believe that you can do it to motivate yourself to do it. In the context of the RISE organization, you can talk about self-efficacy in terms of the staff themselves. Do they believe that they have the skills to carry out co-design or participatory design? But then you can talk also about the self-efficacy of the community, and that taps into what Allison was talking about in terms of social capital. Like, do you believe that you have the power to change your community, to make sure that your kids stay healthy, to make sure that your water is clean, for example? So I guess those are more adaptations that we came up against when we were applying the framework, and there will be more, I'm sure. So yeah, but at this point we're trying to be as flexible as we can with it, rather than try to recreate an entire new framework. But great question, thank you, Rob.
Other questions or comments? Feel free to raise your hand or just put your sound on or put it into chat. While people are thinking of questions, I just want to ask Allison and Naomi, and maybe I'll target this at you. No, I'll ask you, Allison, thinking about the implications of this for teams who may be designing water infrastructure, who may not be familiar with principles of gender as a construct, and intersectionality and disability inclusion. What are some of the key lessons that you think that teams could do to put into practice some of the findings from this research?
Yeah, thanks, Becky. I think from my sort of piece of the work, whether what we're seeing, in Fiji, for example, is just because control communities happen to have higher social capital, we can pretty safely assume that if people trust each other more in their community, trust their local leaders, get support from each other more, that's going to have really important implications for how they handle shared infrastructure, right? And so the idea that these sort of social constructs and who gets involved in social support and who gets left out of those conversations with local leaders, and that practice of collective action in communities, measuring that somehow at the start, so that we don't just assume that a community is capable of and wants to work together specifically around something like, a shared wetland for filtering their shared poop. There's been a lot of pushback around that in some of the RISE communities. And so, just thinking not only about measuring sort of, we would have loved to have had baseline, but at this point now we know before the infrastructure is involved, sort of which communities might need that extra help to really come together around infrastructure that might be a little bit controversial.
Thanks, Allison. Naomi, from your work, have you got any suggestions for what teams doing this kind of work may need to put into place to do more gender and socially inclusive work?
I'll default to my default answer, which is starting with self-reflection. So that point around walking the talk and starting with gender equity and social inclusion within your own teams first, and making sure, I think first and foremost, acknowledging where the limitations are and being okay with, being okay with admitting what we don't know and where we need to learn more before expecting to see results of that in the participants of the programs that we're implementing. And as a sort of follow on from that, recognizing that gender equity and social inclusion looks different everywhere we go. So, and that's an important sort of connection to the, I guess, you know, trying to do work that is post-colonial or not colonizing, is recognizing that it looks different everywhere we go. And that's the importance of having partnerships. So yeah, those two main points.
See some lovely comments from Annette and in there, and also a question from Jane. Jane, I'll read it out. You acknowledge Allison, Naomi and the team for the great research. The results in Indonesia make sense with me as well. I'm wondering how your findings will contribute to inform our global scale up of the co-design or the NBS approach.
Yeah, I think one of the outputs that was listed on that last slide is our toolkit that's being led by our colleague Dasha, but that has inputs from the social capital work and from Naomi's work using the CIFR. And that is really going to be a how to do this reflexive practice that Naomi was talking about and marry the concepts of gender and social inclusion with participatory design, and take all of the great learnings that we have from things we did right and things we did wrong in community engagement and co-design in Fiji and Indonesia. And the hope is that RISE itself can use that for scale up or scale over to the other 6 communities in each country, the 6 communities that are now control communities that will eventually get the intervention, as well as be instructive for thought-provoking, not prescriptive necessarily, but thought-provoking for other folks as well.
Any last questions or comments? Does any of this resonate with your own work? I know there's lots of people here who've been involved in WASH and water infrastructure. Okay, we might call it a day there. Please join me in thanking Naomi and Allison in sharing their work and their findings and presenting it in such a clear way. I think there's lots of implications for the work that you have been leading for water sensitive work around the world and also work in informal settlements. So thank you very much. This is the last seminar for the year, and we will be restarting our seminar series in February next year, and please join with us, and thank you very much.